Introduction for Case A is a Malay pregnant woman aged 24 years old who is a housewife that practices sedentary lifestyle and life in Kampung Rusila, Marang, and be received secondary education. Her husband is an offshoreman who is 30 years old. She is currently on her 37th week period of gestation and due on 5th April 2023. This is her second pregnancy, where her first child was born 2019. She was diagnosed with anemia during pregnancy. Her hemoglobin level at her 37th week period of gestation. Nowadays, she is being taken multiple tablets to prevent iron deficiency during pregnancy with other medicines such as ascorbic acid, vitamin B complex, and folic acid. Before this, she taking ferrous fumarate, but it's not suitable with her, so her professional physician had changed to multiple tablets. All her tablets been taken one tab once a day. For medical diagnosis, Case A was diagnosed with anemia, which is a hemoglobin level of 9% throughout a 37-week period of gestation. Anemia during pregnancy is a major source of public concern, as most pregnant women do not know the danger of the disease to the fetus. By having anemia during pregnancy, it will cause blood doesn't have enough healthy red blood cells to carry oxygen to support growth and development of the fetus. Patients with anemia that feels fatigue, weakness, and dizziness as not enough hemoglobin. Besides, anemia can endanger both mothers and child health as leading to the low birth weight. Adherence to a balanced diet throughout pregnancy has an impact on maternal body weight as well as long-term health of both mother and children, as fetal also able to develop anemia and delay development. Blood tests were conducted for anemia during the second or third trimester, which are hemoglobin test and hematocrit test. Hemoglobin test is used to measure the amount of the hemoglobin, as it will be known by iron-rich protein in red blood cell that carries oxygen to the tissue body, while hematocrit test is used to measure the percentage of red blood cell in sample blood. For diet diagnosis relations, patients of anemia need to taking food that high in iron so that it can normal hemoglobin level in blood. For food that they need to consume is high in protein and vegetables. For example, can be taken 1 pieces of chicken breast or 2 pieces of mashed pork meats. Then bitter ground need to take for half cup and spinach for 1 cup. All the vegetables need to take 3 servings every day in main meals, as it can become healthy main meals besides prevent for anemia. Next, anemia patients also need to consume food that high in vitamin C. This because vitamin C helps the absorption of iron in blood. Fruits also need to be taken 2 servings every day in main meal, as it complete the food pyramid needed. Fruit that high in vitamin C are watermelon, mango, papaya, and guava. However, when taking hematinic tablet, need to avoid taking this kind of food such as egg yolk, milk, tea, and coffee, as this food may restrict absorption of the iron in the blood. If patients still want to consume this food, they need to take 2 hours or after taking hematinic tablet or main meals. For medical drugs, anemia patient needs to take some of medicines as to treat and prevent low blood levels of iron during pregnancy. For Case A, she was prescribed with 10 mg of multiple tablet before being increased into 2 tablets, 5 mg folic acid, 41 mg of vitamin B complex, 100 mg of ascorbic acid. All the medicine be taken once a day. However, she had been discontinued taking ferrous fumarate due to vomiting and diarrhea when taking it, and changed into multiple tablet. Besides, multiple tablet need to take 1 hour or 2 hours after meal, as it effectively affects when empty stomach. Must avoid taking food like tea, coffee, and milk that can interfere with iron absorption. all of these medicines it had their own adverse effect, which metformin tablet may cause vomiting, nausea, constipation, and change color of stools. However, in study that show 80 of pregnant women that involved in receiving metformin experience less nausea, constipation, and vomiting when consuming it, while for folic acid tablets, it may cause skin rash, include itchy, swollen, and redness. Besides, will have tightness in chest that may lead to trouble breathing and talking. Ascorbic acid is side effects such as stomach cramp, nausea, and headache. Taking more than 2000 mg daily may cause kidney stone and severe diarrhea. Vitamin B complex, it contains various types of vitamin B in one tablet as it had combined with other vitamin B. Its side effect may similar to the other vitamin B, which is skin rash, skin flushing, and vomiting. For nutritional interventions, nutritional assessment and intervention it can known by nutritional status of case A that are assessed and interpreted according to anthropometry, biochemical, clinical, and dietary assessments. For anthropometry data, it's been recorded with high BMI and hemoglobin level of case A. She had a normal BMI throughout her 26 until 37 week period of gestational. During her booking date, she had underweight BMI. However, she able to achieve normal BMI during this pregnancy. On her 26 and 30 weeks period of gestational, she had normal hemoglobin level of 11.8 gm%. However, it started to drop to 10.3 gm% on 34th week period of gestational. Then it became worse on 37th week period gestational, where her hemoglobin level at 9 gm%. For biochemical tests that are conducted is urine and blood tests. For urine tests, albumin and sugar tests were taken and the result come out negative. For blood tests, it been carried tests of hemoglobin and hematocrit tests. Blood tests taken to check hemoglobin count. It showed that hemoglobin's 9%, which is less than 11 gm%. Besides, hematocritics at 30.5%, which is less than 35%. Both of the tests is not good result as it's less than normal range. For clinical assessments, it's not been stated. Dietary assessments is a 24-hour diet record for 1 day to assess case A dietary intake. For her diet record, it showed that she not had enough and proper nutrients as she be taken 4 meals only for a day. And it's not enough calorie for pregnant women with anemia. As we can see, she had curry puff, nasi lemak, and hot Milo for breakfast. Then for lunch, she had white rice, mixed vegetable, and ikan masak lemak. At evening tea, she had eat mixed nuts, while for dinner she take white rice, fried spinach, fried chicken, watermelon, and tea ice. For supper, she take maternal mix and metformin tablet. She take metformin tablet with milk, which can restrict absorption of iron in blood. Besides, she only take 1 serving of fruits daily meals as it's not enough for absorption of iron with vitamin C. Nutritional intervention was done by SOAP technique. It can make a plan to help and prevent of low blood level of iron during pregnancy, subjective head and iron deficiency anemia IDA. Assessment that had from patient is anthropometry, biochemical, and dietary assessments. However, clinical doesn't have anthropometry able to know weight, height, BMI, and hemoglobin level. For this case A, she had 53 kilograms, 154 cms, and normal BMI of 22.3 kilograms per meter with 9 gm% at 37 period of gestational of hemoglobin level. For biochemical, it will test urine and blood. Lastly, for dietary, she had been asked 24-hour diet record for 1 day. Plan that been due for her is to have regular meal, which is breakfast, lunch, dinner, to add 4 type of food high in iron everyday meal times, to add 2 snack between meal time during morning, tea and supper, which high in vitamin C or iron, and to eat enough healthy and diverse diet according to Malaysian Healthy Plate. Monitoring evaluation, she doesn't get as she near to due date of birth. Nutritional diagnosis, she had been diagnosed with anemia that is related to poor intake of dietary choices as evidenced by diet recall. Energy intervention is energy requirement using recommendation nutrients intake RNI 2070 for pregnant women at third trimester, which is 1,610 kcal per day that were at with 470 kcal per day for third trimester. So it turned out to be 2,080 kcal per day. Energy chosen is 2,000 kcal per day. For micronutrients requirements, carbohydrate is 50% that turn out 14 exchange, protein at 20% it turn out 8 exchange, and fat is 25% take out 5 exchange. All of this carbohydrate, protein and fat is being calculated with 2,000 kcal per day. This is macronutrient distribution as to give a proper and enough nutrient for the patients. It includes breakfast, morning tea, lunch, dinner and supper. Then menu planning was created to help case A to get her normal hemoglobin. 3 days menu planning that include 3 main meals with morning tea and supper. 2 menu planning for weekdays and 1 menu planning for weekend. All the menu planning had 3 vegetables and 2 fruit serving. This is first menu planning. Breakfast had fried noodles with water spinach, fried chicken and boiled egg, while for morning tea had fish curry puff and hot tea. Lunch had brown rice, clam krabu with ferns and pineapple, while dinner white rice, chicken tom yum, fried kales, watermelons. Supper, she had low-fat milk and cream crackers. Second menu planning, which is breakfast, had fried rice with kale, meat and fried egg, while for morning tea had sandwich sardine and hot tea. Lunch had a white rice, sambal cencaru, ikan, roper gaga, orange, while dinner white rice, meat singam, fried spinach and guava. Supper, she had low-fat milk and bread. This is third menu planning, which is breakfast had fried kway teow with water spinach, fried chicken and boiled eggs. While for morning tea, she had a fish curry puff and hot tea. Lunch, she had a white rice, sambal sotong, raw ferns and papaya. While dinner brown rice, chicken kurma, fried bitter crown, mango. Supper, she had low-fat milk and boiled chickpea. For the discussions, according to the Case A anthropometry measurement, it showed that she had 9 mg% of hemoglobin level throughout her 37th week of gestational period. She started to drop her hemoglobin level during 32nd week of gestational period. Case A, she is not taking hematinic tablet that provided by professional physicians as this caused nausea and vomiting to her during early pregnancy. From her 24-hour diet record, it showed that she did not consume enough in her diet, especially green vegetables intake. This resulted in anemia. It advised for her to monitor her hemoglobin level by taking medicine as prescribed to had more than 11 mg% of hemoglobin before she delivers baby. She also needs to eat enough healthy and diverse diet according to Malaysian Health Plate. However, she needs to increase intake of green vegetables, fruit high in vitamin C, and protein that high in iron. The right portion need to have 2 servings of fruits and 3 servings vegetables every day. Besides, prevent taking food that will barrier absorption of iron like tea, coffee, and eggs yolk. Case A was advised to have 2 healthy snacks between mealtime, which is during morning tea and supper. As a conclusion, Case A was a pregnant woman that diagnosed with anemia as shown by decreased hemoglobin level of 9 mg% throughout 37th period of gestational. Anemia during pregnancy can result negative outcome for mothers and fetus, which affect growth development of fetus and preterm delivery. Healthy pregnant women with normal hemoglobin must be obtained throughout the pregnancy to ensure that both mother and fetus fetus will be healthy. Thus, intervention plan and 3-menu planning have been given, and it's hoped that case A can comply with suggestions to ensure healthy without anemia can be obtained throughout her pregnancy.